Hello and welcome. I'm Dr. John Stracks. I'm a physician who focuses on the reduction and elimination of physical symptoms using mind-body medicine methods. If you'd like to learn more about working with me or our staff, please visit our website at cormendihealth.com. I am here today with Paul Wyner, who suffered from chronic pain issues for about 15 years before ultimately finding relief. By nature, Paul's curious soul and an avid reader, and his research over that time period eventually led him to an understanding of mind-body medicine. By learning about these strategies, Paul has made an amazing recovery and graciously agreed to talk with me and with all of you about his experience. This interview is a third in a series about people who've used mind-body medicine methods with great success and have also dealt with an issue that needed physical interventions such as surgeries. And so Paul's going to tell us about both sides of that process and more. Paul, thank you so much for being here with me today.
Thank you for having me.
So it's helpful for people to understand where you were and where you started from. Can you give some background about what you were dealing with over that time period and what it was like when the pain was bad?
Yes. Give me a
And
few
we have
minutes.
plenty of time. And so there's plenty of time to
Okay,
tell the story.
perfect. Okay, so as you suggested, 15 years, a long journey. And like a lot of people, it started with kind of Western medicine. Hey, what do I have? Well, it looks like you've got this and you've got that. And then in the very beginning, it was interesting. I had just had neck pain and really hard to turn my neck. So I, at that point, started and tried Eastern in terms of acupuncture, acupressure, cupping, massage, and other kinds of, we'll call them non-interventional relief. But I will tell you, acupuncture needle in your hand right here, that feels that feels very invasive. So but no relief.
Yeah.
Eventually, it turned to, well, I'm going to go see one of the most premier headache specialists in Chicagoland, Dr. Robbins, and well published author and subject matter expert in headaches, a lot of them migraine headaches. So I went in and we started. I mean, they identified it as eventually daily chronic, weren't sure, migraine. And so we started with Botox and we started with exercises. And so 9 shots in your head and the back of your neck.
Mhm, mhm.
Yeah, not a lot of fun.
No.
And it just wasn't taking care of the headache, which really that occipital bony ridge is where it's like, this doesn't feel like head. This feels like neck.
Mhm.
So finally, after a couple of years of this, I said, I need an MRI, or I'm suggesting. They're like, oh, I have an MRI. Did the MRI, which we'll get into imaging a little later, but the MRI showed spinal stenosis and a bulge here and a bulge there. And because I'm still in that Western mindset, oh my God, I'm in trouble. And at the time, didn't understand that people have structural issues everywhere.
Mhm.
And so they said, we're done. You need to go see a pain specialist. You're way beyond our scope. And occasionally, they would prescribe a pain pill, short term, see if that gave any relief. And it was so.
Right.
So we
And
do the image.
just to be clear, did they refer you out because of what they saw in the MRI? Did they
A
say
hundred
like, oh,
percent
that's so bad, like we can't treat that. We have to
right.
send you to somebody who's more structural. Okay.
100%. Met with a pain specialist and pain manager. He was board certified anesthesiologist, and he looked at the MRI and laughed, and it was like, you were told this is bad. I will show you bad. And so at that point, he took over, and so the course of action, we did facet blocks, we did nerve blocks, we did all kinds of anything just to see if we can't stop that nerve, sense of pain traveling up my neck and into my head. And then the next course was medication, narcotic medication. Not the happiest about it, but it worked. initially, still doing the well, I don't want to go the non-invasive procedures. So we
Right.
do that, get an occasional shot, cortisone shot in my neck, and frustrating. And so I've seen all kinds of doctors, chiropractors, did hypnosis, did pretty much anything. There's so many people I've talked to who are involved, and sure we'll talk about curable. The story is the same. I'm waiting for someone to tell a different story, like, hey, I had pain, I sought out Dr. Stracks because, mind body, that's the way to go. It is usually last resort. I've tried everything.
And
And
when
so,
do you remember when they started prescribing opioid medications to you? Because it's not nearly as common now as it once was. Do you have a sense of sort of when in that process?
yeah,
Say if it
I
started
would,
around 2000, let's start about 2005.
oh no, to around, oh, yeah. So, yeah, about 2006, 2007,
Mm,
but it was small doses of
yeah.
not a really strong pain medication.
Mhm.
And so it wasn't, and through like June of 2015, I was still occasionally being treated. But at that point, pain manager kind of really took over a whole lot of stuff for me. And, that goes back probably 10 years. And then there was stronger medication and it was, a routine. So it was taking a lot of, it was at that point, oxycodone, Percocet. So pretty strong medication.
For sure, for sure.
And, but,
And
but some relief.
and did it tend to did all of this get worse over time? I know we're going to talk in a minute about how you found out about the principles of mind-body medicine, but what happened over time? Did the pain get worse? Did it go into different parts of your body, or did it just sort of stay in that general area in your neck at about the same level?
Interesting phenomenon because it also happens. I didn't understand it at the time, but yeah, it started to move, and that was really unsettling. Moved from my neck, head, shoulder, knee, ankle, and so didn't pay much attention to it. So I golf and maybe had a bad golf swing, and remember talking about it, and now my elbow is messed up. Connection. Oh, that must have been golf. I must have, had a bad swing. So that's the conventional thinking that had gone on, always looking for cause and effect. And the cause and effect had to be physical trauma that set the pain.
Yeah.
So
And if once you understand pain science and brain science, you understand that the pain moves around in the brain and then shows up in different parts of the body. It's not that like you get your elbow wrong on a golf swing or a forehand and then damage that too. So it's
yeah,
not multiple different conditions. It's all the same. Yeah.
correct. But it felt like different things. And wow, I gotta not be clumsy, gotta be on my game. And
Yeah.
maybe I'm running too hard on concrete instead of grass, that kind of
Right.
stuff.
Right. And so, you by your nature, as I said in the introduction, like you weren't willing to just sit around and say, okay, like here's the answer. I'm going to be in pain and I'm going to take this medication for the rest of my life. And so, how did you start to understand that maybe there were other answers out there?
Research. At the time, my wife was, she had chronic pain, and just seeing what she went through and the different doctors, and it started to resonate that there doesn't seem to be a good strategy. It's all the same, do this and let's do that, and it's x-ray and MRI and lots of procedures. And so it just kind of awakened me to, I'm not going to find answers through medication, and I'm not going to find it through regular the doctor community, who still today, it's a little upsetting, still a lot of them are set in their ways that it's not a thing. It's psychosomatic, it's in your head. And it's like, yeah, correct, it is in my head and it's in my brain. And so started to look for another a different way. I did not want to be on long-term pain regime, and I wanted the headaches to go away. They were at times debilitating.
Yeah. And so then what was the first thing? Did you read about this? Did you find one of Dr. Sarno's books? How did you start to
Yes.
enter into this world?
Well, the first book was Mel Pohl, and just kind of give me an understanding of there's something more than physical trauma that goes on, and that led me to the discovery of Dr. Sarno,
Hmm.
and it was whoa, wow! It was opened my mind to okay, this sounds a little far-fetched, but who knows, maybe. And so,
And if
reading
you're
through it.
listening and you don't know Dr. Sarno, because these days a lot of people actually don't know Dr. Sarno, but he was one of my colleagues in New York City, since passed away at the age of 94, I think. But he wrote a number of books in the 1980s, 1990s about this idea that pain is a reflection of what's going on in our lives, just as not as much, if not more so, than what's going on in our bodies. And that if we pay attention to our stressors and our experiences and thoughts and feelings, that's actually where the pain is coming from, not necessarily from a disc or a tight muscle or anything else on a physiological level.
Very true. Well, so after reading him, I discovered through him Dr. Schubner, and so read him and some of his exercises and realized this is a journey that I don't get it. I'm skeptical. I need to really find someone to help guide me. So that started with a search for you.
Mhm.
Didn't know it was you, but I knew your name, and I knew at the time Northwestern Hospital, and tried to track you down there, and you were no longer there. And I panicked. It's like, where is he? Like, where's Waldo? And then found you. And we met, oh
Found me like
gosh,
20 minutes away from your house, right?
you were very close. Yeah, I could have hit you with a rock.
Yes.
Sometimes I wanted to hit you with a rock.
Yeah.
So I found you, scheduled an appointment. I think that was like 2017, and we you did a pretty in-depth, questions, and what's going on. Tell me a little bit about your background, your history, and you were able to identify that. See, I don't think all this is physical trauma, and then started the course of me understanding kind of how it all ties together, and helpful, incredibly helpful to have someone who, I mean, this is what you do to help understand it in layman's terms. And so from there, I think one of the first things you suggested was Curable, really downloading the app and following, starting with brain science, and, it goes on and on from there. And it was that plus you that started opening my mind, my brain, that there's something out here, and that's pretty cool. And who knew, that trauma isn't always physical, and sometimes it's emotional, and a lot of it was emotional. And so I fought it and fought it. It's like, no, this can't be this easy. And from Curable, I joined a Curable group, 10 weeks, I think,
Mhm.
8
10, 12
weeks.
weeks, somewhere in there. Yep.
And it was kind of group learning and sharing, our stories. And my one big takeaway there was, wow, I am not in very bad shape. Some people are in worse shape. So as bad as it seems, take comfort in a really weird way. Somebody probably has it worse. But that opened my mind to childhood trauma, and joy and gratitude, and so many different components. And so it could feel the beginning of, I think there is definitely something here. And during the whole time, need to point out that I've worked with you a lot.
Mhm.
And what made you so very special to me is that it wasn't a cattle call. Come in. Oh yeah, you're doing great. Move on.
Mhm.
It was it was work. It was some therapeutic work, and I was seeing a therapist at the time who didn't really understand mind body. And not that I want to advocate that everybody sign up for your practice to get therapy, but you were amazing at helping me understand where all of this came from and really understanding trauma
Mhm.
and toxic relationships. And I think that was that was like the aha, for me.
Right. And so thank you for the compliment. And I will compliment you back and talk about how hard you worked over a long period of time to gradually work your way out of this. Do you feel comfortable talking about some of the some of what you found in terms of what had gone on or was going on that was then showing up in your body? Like what kinds of things did you learn over time were showing up in your head or your elbow or other parts of your body too?
So much was tied to early childhood, and it's used a lot of triggers and trigger behaviors. And at the time it was a stressful time, whether it was job changes, marital changes, and kids, growing up, going to college, their issues, there was always something. But in the background, it started when I was young guy, little guy,
Mhm.
from that I can remember, from 8 years old.
Yeah.
Never
And
had pain,
mhm,
when I was younger,
right.
but it kind of set the stage for what was going to develop later.
Yeah. And when we talk about pain, and you said this a couple of minutes ago, that we tend to think that if we have physical pain, then there must be something physically wrong. And when you're a kid, that's the model that you learn. And so if you're playing basketball and you sprain your ankle and you look down and you can see that it's swollen and it hurts, you think like, oh, I damaged something in my body. That's why it hurts. And so then we all grow up with that idea. That's what pain is about. But the research ultimately doesn't say that. It doesn't say that pain is about damage. And so if pain's not about damage, then what's pain about? It turns out it's about this sense of danger. And so if you grow up in a stressful environment, right, you learn that there are aspects of life that are dangerous, whether it's relationships or the way you think about yourself or the way that other people think about you. And then, as you said, like, you didn't have pain issues when you were a kid, but it set the stage. And so then you're an adult and you start to run into the situations that you're talking about: job changes, changes in family dynamics, kids having babies, babies growing up and going to college. And if you are predisposed to see these things as potentially dangerous, shifts in our lives, shifts in our relationships, shifts in our ability to make money, all of that, then pain, it turns out, is actually a pretty good brain response to some of those situations. And so that, I think, is part of what you and I talked about over time, that your body wasn't damaged, but these situations, because of your background, alarmed you enough that your brain would create the pain to distract you or show how
Yes.
difficult it was, or to send a message to yourself, message to other people. And that's why the physical pain was so bad and why nobody could treat it very effectively by trying to intervene on a physical level.
Yeah. Well, it was throwing darts at a dartboard for, traditional doctors. And even today, see a doctor and for something innocuous, and it's, well, yeah, definitely this, and it's related to, your fall. And it's like, no, I'm pretty sure it's not. So the biggest, I think, takeaway, twofold. One, imaging. Story, whether you told me or it was in Dr. Schubner's book, a place, and I can't remember the country in Europe, and this was the
Lithuanian.
story,
Yeah.
yeah, whiplash.
Mhm.
And that was so fascinating to me. There is not a word that translates from English to whiplash in that country. So, you get rear-ended and you're not thinking, oh, I have whiplash. You're thinking, who hit me and why do they hit me? And so the study, long story short, was specialist came in, radiologists, and they could not identify correctly based on MRIs, mangled, vertebrae, and they'll say, you're mangled. How bad is your pain? What do you mean I'm mangled? No pain. And so it was kind of a big wake up that images are not reliable. And there's a future story about me trying to prove that point to you, which was kind of futile at that point. But the second part of that was just understanding brain science. And your brain is super clever. And if there are things you don't want to go back to and revisit, yeah, your brain will distract you. And it distracted me through pain. And I'll tell you what, during all that pain, never thought about my childhood, never thought about triggers and how this affects whatever. So it was, kind of those two things that you explaining, stop focusing on the images because all it does is reflects a situation, right? Not a cause. You have what you have. Here, my spine's here, yours is here, no correlation. And that was pretty big.
Yeah. And then, so over time, you got better, right? Less pain in various parts of your body. What was that like? How long do you think that process took for you as you started to see some relief through this?
Well, because I was very skeptical and learned about fear, and fear was a huge contributor. Thought process, what if this doesn't work? What if it comes back? What if it goes to a new location? What if I can't control it? So I dug in a little bit. So the curable group helped a lot. And I think the turning point was when I had shoulder pain. It's like micro tear, rotator cuff. I didn't know what it was. And you're explaining it's mind body, probably a toxic relationship, something along those lines. And I'm like, you don't get it. You and your fancy mind, body, and terminology. I'm going to an orthopedic specialist.
Yep.
He can help me. Did an MRI. And I was like, I remember talking to him. I did an MRI. Ha! You know what they found? Micro tears and a separated labrum. And you were kind of like, and so? And I, with my tail tucked, between my legs, I had to tell you, he did not make a correlation. My separated whatever had nothing. He's like, I can't account for your pain for where it is. You shouldn't have it. And I had to come to you and tell you, okay, that whole image thing, okay, you're right. And we started working on, well, maybe there's toxicity and a relationship. And what's interesting, it could be family, it could be friends, it could be bosses. There's not a recipe. It has to be, someone tied very closely, spouse, relationship, or whatever. Mm-hmm. And when we started to focus on some of that, I remember coming in and kind of doing, hey, I hate you, but I can move my shoulders. I can do everything that I wanted to be able to do.
Yeah, yeah. And your personality is one, I mean, you're determined. Once you find something that you're interested in, you keep going and keep moving forward. And so you talked about some of the resources that you've used already. So you started with Mel Pohl's book and then read one of Dr. Sarno's or more of Dr. Sarno's books. You read Dr. Schubiner's book, Unlearn Your Pain. Curable is a scientifically based app about chronic pain that I'm one of the medical advisors to. And so you use the app. They have this 12-week group that you took that was useful to you. You probably were in some of my groups or classes. Were there other resources too that you remember that you used or found helpful?
Anything that I could read, any workbook I could find, any study, listen to lots of interviews, look for information on YouTube, Google this and Google that. And I even at one point tried which I thought was really weird. So if mind body's weird, it was called brain spotting.
Mhm.
So kind of looking for anything that could supplement the progress. The progress initially was slow to me, but I want instant gratification. And the
Mhm.
progress is slow. I could blame you because that would be easy,
Yeah.
but it was me. It was me digging in because fear was still the big thing, and some skepticism.
Mhm.
And so anything I could get my hands on, talk to people who are in pain, try to understand their journeys, listen to lots and lots of interviews and people that went through similar journeys, and light bulbs started to flash.
Mhm.
And it was when I threw myself, mind, body, and spirit, into really embracing this as this will work, not can this work? This will work. My progress ramp was very, very quick,
Mhm.
and there's work. It's not oh, it's my brain. Okay, cured. Hallelujah.
Mhm.
I did the work, and what I found was breathing. So simple. It's breathing, but it's breathing, and it's centering and awareness. I mean, there's some silly things like, sit with your pain. And I believe Alan, one of your contributors,
Alan
and I
Gordon.
forgot what, somatic tracking, one of them, but it was like, don't fight it, sit, understand, where is it? Is it moving? What does it feel like? And it started to allow me to not be fearful, and it's just something,
Mhm.
and be aware. So it helped awareness
Yeah.
and in understanding.
Right. And so a couple of things I want to highlight in there. So number one, I want everybody just to get better once they figure this out. Like I want the course of progress to be like that, or even better, right? The course of progress to like this. Like I want people to be better tomorrow or yesterday. But you're describing more this process where like it was slow at the beginning, but you stuck with it. And then eventually you started to see the acceleration and get better. But there was that background work that had to happen first. And then you also talked about the fear. And so I was talking about the brain reacting to the sense of danger, which we can also term as fear. And you talked about all the interviews that you listened to and the books that you read and the information that you gathered. And so one of the more common questions I get is everybody's scared of pain, right? I mean, pain is a scary phenomenon. That's what makes this difficult at the beginning. And so the question that gets asked a lot is, well, how do I get past the fear? And so what do you think your answer was that? Do you think the two are directly related, that all the background work that you did and all the interviews and all the information eventually calmed down the fear for you? And do you think there were other factors that helped to squash the fear ultimately as well?
Well, continuing to have meetings with you and continuing to understand what it is. I mean, the brain science part. I mean, some people scream at their brain, you're no danger to me, you're not a threat, or identify pain as a different word, my pickle hurts today,
Mhm.
kind of thing. So I tried open-mindedly to try some things, but what I found was kind of the therapeutic part, the getting out. These things have been in here for so long. And the more I started to try to be honest with what that all meant and how it all started, there started to be, and if I journaled, I hate this person, and, didn't send a letter, but wrote a
Mhm.
letter to people that had somehow created a toxic relationship.
Mhm.
Doing that, the breathing, the journaling, the continued talking to you, now I started noticing, wow, okay, that acceleration. And there was a medicine component to that as well, and they kind of moved together, which was kind of interesting. I thought I would be on pain medication forever, And as I embraced mind body, I started realizing that, I'm taking pain medicine because that's fear.
Mhm.
If, what if I let go completely? What's going to happen? And we got to a point, you and I, where it's like, I'm done. This is working. I believe in it. I'm passionate about it, and just started seeing if there was toxicity relationship wise, I eliminated that toxicity. And, one relationship, oh, my shoulder is great, my ankle's great, my knee's great, my headaches went away. And as they are decreasing in frequency, I made a decision that I want to be off medication. I want to be off pain,
Mhm.
opioids, and talked to that doctor. And we came up with a protocol to start weaning. And that way, and you were so supportive. So what I loved about mind body is that I was never discouraged from whether it's physical therapy, if I need to take medication, no judgment zone. You got to do what you got to do. And we would have gotten to, well, if this is working, you don't need this. And I just made the decision, don't want to do this anymore. It's not worth it. It's hard when you're starting to become dependent on something. And so as we wean from 10 pills to 8 to 6 to 2, then that one magical day, and I remember calling you saying, guess what? Cured. And it was the most magical feeling that I have probably had in a really, really long time. And every day, the sun's shining, birds are singing, and really changed your perspective, because I didn't worry, is it going to come on later? Oh my God, I startled, turned my neck, and I could talk to my brain and say, you turned your neck, you sneezed.
Mhm. Mhm.
Yeah, it'll go away in 15 minutes. You want it to go away in 15 minutes? It'll go away in 15 minutes. And it kind of changed my dynamic, my belief system. And then I started being like Johnny Appleseed, and anybody I talked to, you need to talk to Dr. Stracks. Really? You just got divorced and and your back hurts? We need to talk.
Mhm.
You need to talk.
Yeah. Yeah.
Give Dr. Stracks a call.
Yeah. And so the medication, so that's in addition to the questions about fear, that's another common question that people have. If they're on medication, at what point would they wean off, or how would they do that? And so you talked about 10 pills to 8 to 6. And do you remember sort of how long a time period that encompassed? Did you wean off in like 2 months or 2 years or somewhere in the middle, or how did that
Yeah,
happen?
great question. So I wanted to do it the right way, and I believe it was you who we talked about, I think, titration. Is that the word?
Yep.
And you were kind of advocating you don't need to do big, go from 10 to 2.
Right.
Do it smart, do
Yep.
it manageably.
Yeah, I
So
mean, I say all the time, like the research to me says you can't do it too slowly. You definitely do it too quickly, but you can't do it too slowly.
yeah, so it was about a 10-month plan, and we would decrease, decrease, decrease. And every decrease, there was that initial thought, oh goodness, what am I going to do? I don't have. And then you got to a point where it's like, yeah, we decreased. Cool. So then it was more, the worry then was, am I going to have any kind of like withdraw because of this? It wasn't, is my head going to hurt? So it was kind of interesting, because the shift of focus wasn't fear that my head's going to come back, but fear, what am I going to do without my medicine? And then we got to a point where I'm just excited to every month cut down, cut down, cut down.
Mhm.
And then went to my doctor and said, hey, good talk. I'll miss you.
Mhm.
Don't need you anymore. And what a great feeling.
For sure, for sure. And just trying to giving people listening the sense of timing here. And so we had talked about, the first pain symptoms probably showed up in you maybe in the mid 2000s, and you and I met in the mid 2010s, and we're in 2023 when we're doing this interview. But After you learned about this, read Mel Pohl's book and Dr. Sarno's book and met me, do you have a sense of roughly like when it felt like you were cured off the medication, doing most of what you wanted to do in your life? How long a period do you think that was roughly?
Five, 4 or 5 years.
Yeah, yeah. And I think that's pretty common. And I think, people will read, say, Dr. Sarno's book, and a lot of the characters in the books get better in like a page or a paragraph. It's like
Yeah.
I went and I heard Dr. Sarno speak, and then I called him 2 weeks later and he said, I'm cured. And I think what you're describing is a lot more of what I hear from people, which is that gradually over time. And if you're listening and thinking like, I don't have 5 years to get better, Paul and other of my patients, get in touch with me periodically, even after that long period of recovery, and say like, it's just amazing. It's been a year since I really thought about pain, or 6 years since I really thought about pain, right? That time span, 2 years, 5 years, longer sometimes, that compares to, the next 50 years you have to live your life and live your life without these pain symptoms that you once had.
I 100%. And so for me, 5 years. So, I'm going to be honest with myself. It could have been halved if I let myself just, it's a thing and it will work instead of pushing back. And so I remember the curable groups. I was the guy pushing back. It's like, really, that sounds a little hokey. And so it was me that was preventing a more rapid
Yeah.
understanding and cure of pain. So, but the good part is that it was minimized during this period. Those tens were eights, the eights. I'm not talking about the medication, just the pain level.
Yeah.
And so there was always progress, but it wasn't fast enough. But
Yeah.
I didn't do all the work as
Right.
diligently, right?
And
So
and everybody moves forward at their own pace, the pace that's right for them. And there are people who rocket forward and in a couple of weeks say like, thanks, this is fantastic. And a lot of people like you who slowly over time get better. And there are reasons, and there are important reasons for that. And it's not a competition, it's not a race. And the important part is to get people feeling like you can do what you want to do.
I agree. And I think the pivotal moment for me was when I came to you and said, yeah, that shoulder, yeah, there is something structural, but that's not what's causing this. And once we understood kind of the notion of emotions versus how you act upon those emotions. So emotions. So once I had to come to you and say, okay, I'm in, then I was in. And then the curve was.
Yeah, yeah. And so I want to talk with you, and I've talked with a couple people in interviews lately about dealing with physiological issues while you're learning all this information about the connection between mind and body. And so I think relatively recently you had a pain issue that didn't respond as well to some of the more psychological interventions. Can you talk a little bit about that and what happened there?
Yeah, I started to develop pain in my foot, really kind of the toe, knuckles, and that whole area. And it was really painful to walk. So I saw a podiatrist and surprise, well, no, not surprise. Hey, we should operate. Surgery is your answer. And I'm so angry at myself because he showed me, here's your x-ray, this is this. And instead of, this doesn't mean anything. Let me talk to, Dr. Stracks. Let me get a second opinion. I was in so much pain. I said, yeah, let's do it. And we did it. And recovery is supposed to be, I don't know, let's call it 3 to 4 months. 2.5 years later, I'm in pain. So technically, that chronic pain probably cause and effect. So when I saw a new podiatrist, I saw three. I'm like, not getting suckered in. The first one, let's operate. We can do like exploratory surgery. No, met someone who said we're going to try everything to not operate.
Mhm.
And eventually, nerve damage and things like that. We went in, had the surgery, and it's 3 months. It was late May. My foot feels great. And so in this particular case, it was a thing. And so, part of the healing, I went through some workbooks, and what was really funny for me is he said, prior to the surgery, and the anesthesiologist said, "You're going to wake up feeling so stinking good. You will be on your feet in days." Just planting that positive, affirmation instead of, it's pretty ugly surgery. We don't know what the outcome is going to be. And doing a little research before,
Mhm.
start doing, meditation, start thinking positive visualization, and it feels great. So no pain, no head pain, no shoulder pain. I could do jumping jacks right now for people who are watching, but I won't do that.
Mhm.
So it's great to have my life back.
Yeah, yeah. And so let me ask you a couple of questions about the surgery, because I know that people get confused that we're saying, so much of pain is in our minds, and you had so much relief by paying attention to your mind and your spirit and your past. And so do you know what they did in this most recent surgery that was helpful?
Yeah, so the nerve pain that ran from my big toe, like halfway down the side of my foot, peripheral nerve pain, what they discovered is that I had that nerve. The initial surgery, he pulled the sutures so tight that scar tissue formed around the nerve.
Mm.
And so there was no way to effectively, you can't treat it in your foot. So he went in and released the nerve from the scar tissue, put the protective wrap around it, and found, the second area that just had cartilage and arthritis. And I want to point out the arthritis because I'm, mid 60s, and your body is going to have arthritis, and you're going to have narrowing of your spine, and it's part of an age process. Everybody has it to some extent, right? And so cleaned out the cartilage, and we were good to go. So, skeptical, and he's like, "Stay with it because it didn't happen in a month. I believe it'll happen." And then one day I wake up and I'm like, "Huh, I can walk. I can put
Mhm.
on shoes. I can go run. I can ride a bike. I can do anything."
Yeah. And so do you think you needed that first surgery? I don't know the answer to this. Do you think you need the first surgery?
Maybe, maybe.
It's interesting to think about that, whether sort of the second surgery really was primarily to undo the effects of the first surgery, which may or may not have been needed. But I also know that Laura Burke, who's a curable group facilitator and who I interviewed fairly recently, she's had 17 surgeries on her legs for a variety of physiological issues, and and teaches mind body medicine. She said the same thing, interestingly, that they did an MRI and they saw the scar tissue wrapped around the nerve from a previous surgery, and that going in and taking that out was actually significantly helpful.
Yeah. So, I mean, I know you and I talked briefly about it, and if I had to do it over again, I may have had it. I mean, they're pointing out like you don't have cartilage between your toe joint. It's like, so now today, 3 years later, it'd be like, yeah. So what's your point? Do you
Right.
do you need it?
Yeah.
No, you don't.
And for people who are listening, right, a lot of people like you have been scarred by the medical system, been told like they need to do this or they need to do that, or they can be helped this way, or they can be helped that way, or they're in danger this way or in danger that way. And so a lot of people have trouble entering back into the system and doing physiologically based treatments. And so any thought about what allowed you to trust this particular surgeon to do that intervention for you in a way that ultimately turned out to be quite helpful?
The most important is that he understood mind body, and he also understood that surgery does not have to be a first line defense.
Mhm. Mhm.
And when we can do all of these other things, whether it's, physical therapy, whether it's whatever that process was. So we did the test, we did the MRI, we did the CAT scan, we did it all. And he's like, it's inconclusive. Oh no, it's an image. And I love that because
Mhm.
he recognized it's an image. And eventually we started to figure out that this area is never getting better. We did a couple of cortisone shots and things like that. Maybe there's something more, but that whole process was like 4 or 5 months of, I don't want to operate. And then I'm the one who said, nothing is working. Let's try. And if that didn't work, I'm out after two. And then I would have been living on your couch
Mhm. Mhm.
and until we figured it out. And this one happened to be okay. This one looked like it was a legitimate, bona fide, trauma caused by the first surgeon. And so, but it was different. So initially, it's like, oh, here we go. It's moving around again. And I could laugh at it. It's like, oh, it's here. Oh, now it's in my feet. Cool. What's going on there? So that's that whole sit and just sit with it. See what
Yeah.
that pain means.
Yeah.
Where's it coming from? Is it throbbing? Is it sharp? Is it?
Yeah.
And all of that helped make better decisions.
Yeah. And so as human beings, right, we like answers, we like simplicity, we like black and white thinking. And so it's very tempting for all of us to say it's physiological or it's not physiological. And so people will come and say, do I have mind body syndrome or do I not? Or do I have tension myositis syndrome or do I not? And what I've said for a number of years now is that like it's not black and white. There's physiological components to it, there's emotional components, there's psychological components. And what we're trying to determine is whether there's a physical aspect that's so profound that you're not going to feel better unless we take care of it. Ultimately, that's what you decided with the second surgery, that it needed to get taken care of physically. But I think what I've heard you say both today and other times is that it's been helpful for you not to have to dichotomize here and say it's this or that, but that you can talk to me and we can explore your childhood and your relationships, and you can get acupuncture done or physical therapy or talk to a surgeon or use medication when you need to use medication. And so being able to tap into all aspects of healing, I think has been helpful for you and not feeling like you
Huge.
have to do just one or the other.
Well, what was helpful is that you in your practice, especially, no judgment zone. It doesn't matter. You're handling it the way you handle it. And if we do it in conjunction, you knew, I didn't, that there is going to be a cause and effect. The more, work you put in, the less pain you're going to have. And if you have less pain, do you really need the medication? And so it all kind of tied together. And so with the foot, especially, um, that was huge for me to understand that I don't need to necessarily have this. And talking to you about it first, it's like, what do you think? And so then I had options. And like you said, I absolutely have to do this. I absolutely should not do this. And sometimes you have to do it
Yeah.
or you need to
Yeah.
do it.
Yeah.
But for every other injury I had and every other ache and pain, that was mind body. That was you.
Yeah.
And
And so what's your life like now? What do you get to do, or what do you not have? Like how do you live your life these days?
wake up feeling great.
Mhm.
I don't worry how am I going to feel in 4 hours. Had a big argument with my sister, and like okay, a big argument with my sister. Nothing. I didn't worry about what's this going to do.
Mhm.
And when things were really bad, I said, you know what, I'm going to take a break from you because you are poisonous, relationship wise. And so it allowed me to make harder decisions and choices. But if I'm not in these volatile, toxic relationships, it's awesome. So communication and learning to have better interactions, work, spouse, whatever,
Mhm.
huge also. So there was a unintended benefit, which was learn how to get along and play with the other kids.
Mhm.
And so what was so huge about all of that is that I never had to think how, what, oh my God, what if? So I got headaches. I take Motrin, call it a day, right? Allergy season. Okay, Motrin plus Sudafed. Okay. And I don't think about it again. Then I go and do my thing. And so I have no limitations. I can do pretty much anything that I want to do. And it is amazing not to worry like to bring my medication. What if I don't have my medication? What if I run out of my medication? I don't have to pack it. I don't have to do anything. Bring a little tin. Here's 4 ibuprofen. That'll last me. So those are the subtle changes.
Yeah. And I think, I've heard other people say this too, right? You take medication and what are the side effects? You get sleepy, you can't think as clearly, you get nauseous. And the side effects of this treatment that you just mentioned and other people mentioned too, like your relationships are better, you're generally happier, you live your life more fully. Like that's what we want from medical treatment is we want the treatment to work and we want the collateral aspects of that to also be positive and lift you up. And that I think has been your experience. That
It is
it's not just,
absolutely.
yeah, yeah, not just the pain has gone away, but that other aspects of your life have
Yeah,
improved.
joy, gratitude, forgiveness, huge concepts. So the focus initially is, the brain science, fascinating. Your brain is amazing. Well, not your, our, well,
Our
mine,
brains,
mine and yours. Yeah, our brains. And then it kind of progresses to joy and gratitude and thank you. I woke up today and it's a great day and I feel great. And I didn't experience that. There was no joy or gratitude. I was in pain.
Mhm.
That dictated what I did and how I did it. And now, yeah, I have fun.
Yeah, excellent. Anything else you want people listening to know? Any other tips for people who are struggling or just getting started with this process?
Be curious. That's it. I mean, be curious. What if it works? Not what if it doesn't work. So, positive affirmations. What if I can lead a normal life? What if I can get out of bed? What if I can walk around the block? Be open minded. And the biggest is throw your images away, throw your MRI. I don't want to see your MRI because it doesn't mean anything at the end of the day. And so think differently. Think I don't need to have surgery. Think maybe there's something in there. Maybe there's some kind of trauma. And it doesn't have to be massive trauma. It could be a whole bunch of little events. And they're suppressed, and the amygdala, controls your emotions. Get them out. Talk to someone. Get those trauma, those feelings, those memories. Get them out, and be amazed and enjoy the ride to pain-free living.
Yeah. And I think, one other thing to think about in what you've been talking about is that there was a lot that you did on your own, a lot of studying, a lot of listening, a lot of strategy, and you were able to tap into what other people could offer too. And so you didn't feel like you needed to do it all by yourself. You were able to spend some time with me and talking with me and tapping into the curable groups and other practitioners along the way. And so I think that's a lot of people feel like, reading and using apps is the way to go, but oftentimes meeting with a professional in a variety, whether it's a medical professional or a mental health professional or other practitioners, that's been part of your experience too. And I think doing all that, the work that you did on your own, the work that you did with other people, made it much stronger response for you than trying to do either of those just by themselves.
Yeah, I acknowledge that I can't do this on my own. So one of those people, I needed to talk. I needed guidance, like guided study. That was for me. Other people, it's like read 3 pages of one of your handouts, and oh my God, I'm cured. Good for you. For me, nothing replaced sitting and talking and you asking the right questions. I mean, I was going to a therapist. I'm like, I don't need to go to a therapist. I have Dr. Stracks, who, wore both hats, but, in the confines of your practice. So it's not just here's a workbook, have a good day. And you sat, you cared, you wanted to know what was going on. And again, no judgment.
Yeah.
And so yeah, all three modalities for me worked wonderfully.
Yeah. So great. Thank you. We're going to end the conversation there for today. Thanks so much for being here and being open and sharing your story. I know how helpful it is for people who are going on this journey to hear from other people who have been here. So thank you for being here and sharing your wisdom.
And thank you for being the catalyst for my life today. I owe that to you. And I've said tongue in cheek, no tears. I view it as you saved my life, and I will always be indebted to you. So
When
thank you.
you're going to make me cry.
I said, yeah, no tears.
So thank you. It's been a pleasure. It's been a pleasure to do all this work with you and been a pleasure to be here with you today to talk about it. For those listening, as I mentioned before, if you'd like more information about working with me or any of our staff here, you can contact us at cormendyhealth.com and staff will get back to you with information about what you need to know and details about what to do next. And thank you to all of you who've been here listening each time we record. I'm reminded of how blessed and touched I am to be part of this community of people working so hard on healing in these brave and creative and scientific and cutting edge ways. And so with that, we'll end. Everybody, take care.